I've been extremely pleased with the care that I've been getting from the VA over the last 20 years, but I really believe that there's still some opportunity for improvement. And basically, I say that because of the fact that it's pretty difficult a lot of times to get your appointments when they're scheduled because you have to go so far out. But the providers truly do care for us, and I think that also that they need to get a better understanding of who we are. Every veteran is different, regardless of what battle you fought in. We all are different, and because of that, there's a uniqueness. And I think if the providers understood that uniqueness, it would help them better understand what we need as a veteran. I was born in San Antonio and lived in San Antonio, but then when I was very young, my dad moved us to Louisiana. Shortly after we moved to Louisiana, he and my mom divorced. And he had started a restaurant in Louisiana and was always gone. He worked 7 days a week. And I was the oldest. And of course, being the oldest meant I had to take care of my brothers and sisters. And so I was the caregiver for my siblings. And as such, I was being looked at as an adult, but in reality, I was still a kid. I never really understood what being an adult meant or how to be an adult. And throughout the years, I realized that as soon as I could, I needed to get out of there. I needed to go and be on my own, and I did. In 1965, I joined the Marine Corps. That was my outlet to get away. And the Marine Corps really helped me. In a very short period of time, they taught me what an adult really means. And there were a tremendous amount of help in many, many ways. One of the main reasons that I say that they helped me is because being born in, or not being born, but living in Louisiana, back then, there was a lot of racism. And I quickly realized that in the Marine Corps, or any branch of service, I'm sure, there is no racism, there is no color. We were all the same. And so it taught me a very valuable lesson. Upon joining the Marine Corps, I went out one time. I was very fortunate and was out on a blind date, and I got to meet my wife. And 6 months later, we became husband and wife. But the only problem with that is 29 days later, after becoming husband and wife, I got orders to go to Vietnam. And so I had to leave 29 days later, spent 18 months in Vietnam. And Vietnam was something I will never, ever forget because it impacted me in so many ways, but in a negative way. The things that happened in Vietnam, the number of people friends that I lost will always be on my mind. But the thing that really floored me is when I came back from Vietnam. I thought Vietnam was bad, but the way we were received upon returning to the States, it was absolutely horrible. We came back to the States and there was no debriefings. The only thing they looked at us was sign here, sign there, get your bags ready, and you're going on 30 days leave. The VA, the military, it's like they didn't care about us. They just said, go, you've got 30 days leave. And so I left and felt very, very lost and very abandoned. And, I couldn't understand that. And it's very hard to even to today to think that that's the way we were treated. But the people that treated us the way they did, I think a lot of folks don't realize we were called murderers, child killers. We had fecal matter thrown on us. They would do anything they could to destroy our uniforms. But I guess that's just the way it was back then. After that, though, I did get orders to go to San Diego again. This time, though, I went as a drill instructor. And I wasn't happy about that because that was like going right back to boot camp. And one time in boot camp, especially in the Marine Corps, is enough. But went and I was a drill instructor, and I spent 3 years there. And being a drill instructor really had a great positive impact on me because I had an opportunity to work with 80 different individuals from all walks of life throughout the entire United States and to see them and mold them into a single body and a single unit, and they all work together as one was really a blessing. And then on graduation, to be able to sit with the parents and to hear their input about how great and different their kids were and how pleased they were with the outcome of their kids, and they couldn't imagine that these were the same children. So that really was positive and made me feel good, because now I was in a position to help people, and I didn't have to think back about the way I was treated coming back to the States. After being done as a drill instructor, I was transferred to 29 Palms, California. Talk about being out in the middle of nowhere. But I was in 29 Palms, California, and I became a administrative personnel chief and spent my last remaining years in the Marine Corps there. Upon my separation, my wife and I moved to Santa Barbara, which is her home. Her family was still there, and so we relocated to Santa Barbara. After so many, I want to say a couple years or so, my dad became very ill, and as a result, we decided to move to Louisiana so that we could be with him and to help him through his illness. We lived there for several years, but we finally reached a point of saying, okay, he's doing much better now, and so we want to move back to San Antonio. And we did. And moved back to San Antonio, been here the entire period of time, and truly have enjoyed it, because it is our home. As I said, the VA has been good to me. Some of the things have been a little difficult with the VA, but I can't blame the VA because it's such a huge organization. Getting my disability claims was one of the most difficult processes. It took me 10 years to be able to get my service-connected disabilities into the system and actually get awarded for that. And the thing that really floored me is that every illness that I have is or can be attributed to being exposed to Agent Orange. However, when I initially did my claims, I could not put Agent Orange as a reason I felt I had these illnesses. I guess they felt like they just did not want it to be out there public. But Agent Orange has caused me many health issues. I have heart issues. I have medical implants. I have diabetes, and I'm 100% disabled. And right now I live on 14 different medications a day, 7 in the morning and 7 in the evening. But the end result is I'm still alive. And that's my thanks for the VA and what they've done for me. They truly have helped me. They've taken care of me. I'm pleased with everything that they've provided me. I will always be committed to them because I think that that's what they're there for. They're there to help us. The only issue is it's such a huge, huge organization that they still have a lot of room of improvement. But has it improved? Absolutely, it has. I've seen the changes in the 20-something years that I've been associated and been with the VA. So I think that we're going to continue to see some good things. But I think too, though, that it's always important to understand that we are all individuals, and we can't be looked at as just, well, you have diabetes, so we're going to just take care of diabetes, period. I think it has to be more than just the illness. I think it has to have a personal understanding of the individual, and then what is the issue. Because when you understand the individual, it may help you better understand what needs to take place to solve the medical condition that you may have. So my thanks to the VA for what they've done.